Through today's update from the National Emergency Response Committee on Coronavirus. This is our update with regard to country response measures as at 19th April 2020. Fellow Kenyans, a number of you may be despairing and asking why the numbers keep rising, despite all the measures we have taken. Some have taken to mocking our repeated calls and warnings for self-discipline. Others are looking at us as government to fire the silver bullet for normalcy to resume. Luckily, the majority of you are working with us and adhering to our directives and supporting the initiatives we have put in place against this virus. So far, our analysis shows us that 56% of all our confirmed cases were imported and only 44% have been locally transmitted. With support of Kenyans, we are working flat out, including taking unpopular measures to limit the spread of transmission. So far, we have succeeded in containing the imports, and in the last few days, the very few cases are emanating from our regional quarantine centers. Therefore, fellow Kenyans, we are now worried about local transmission. Ladies and gentlemen, the function of public health and national security is everyone's responsibility. Governments the world over play facilitative roles, and therefore this means as Kenyans we do have a personal responsibility. And going forward, we are calling on Kenyans to work with us, and we shall be activating community policing. This will include enhancement of community participation in the following ways. We shall utilize our community health volunteers in community-based surveillance for coronavirus. In addition, we've ensured that we have deployed public health officers and other multi-agency teams in manning roadblocks together with our policemen. We have activated the Nyumba Kumi initiative, and further to this, we shall now utilize technology in tracking and surveillance of any members of the public who are congregating post-curfew hours. We continue enhancing our capacity for combating coronavirus, and towards this end, we are making good leaps in expanding and spreading our testing capabilities across the country. Today, I'm glad to announce that the Moi Teaching and Referral Hospital in Eldoret and Kenyatta National Hospital here in Nairobi are now testing for COVID-19 disease. The MTRCH tests cover a scope of 22 counties, and this will enable transfer of samples from those countries, reducing the turnaround time. The two facilities have been conducting testing in the last few days and are therefore complementing the existing efforts in the other laboratories. Counties are required, therefore, to continue taking stock of their existing capacities with regards to ensuring that healthcare workers are facilitated to be able to fight against COVID-19. Going forward, fellow Kenyans, all those who break the curfew rules will be assumed to have been in contact with suspected cases and hence will be quarantined for a period of 14 days. The government will hence carry out screening of truck drivers entering and operating in Kenya going forward. This will be done at roadblocks using a combined team of health and security personnel. All healthcare workers in both public and private facilities are required to wear protective gear as part of protecting themselves as they manage the patients. We have received disturbing news that some unscrupulous persons are recycling face masks after collecting them from bins and selling them to unsuspecting Kenyans. In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media. And we therefore say that this is unacceptable and this is actually criminal. Together with this awareness, we're going to be rolling out guidelines on the disposal of face masks, and we shall crack the whip on anyone found endangering the lives of fellow Kenyans for selfish gains. I urge Kenyans to undertake basic due diligence on face masks that they are buying so that they do not fall victim. And also we are calling on the National Police Service, the Kenya Bureau of Standards, the National Environment Management Authority, NEMA, and other relevant government agencies to come and take action on those who are recycling masks and selling them to unsuspecting Kenyans. While still on this case, we are witnessing another unbecoming phenomenon, where people are assuming that using a face mask alone can beat this virus. We've seen cases where people are walking around, not observing social distancing and feeling that the face mask is enough. Fellow Kenyans, the face mask only confers about 50% protection, so we still require you to observe the interventions that we've put in place. Yesterday, we witnessed a situation in Baringo, where elected leaders led a mass demonstration in Cabinet Town, thus endangering the lives of the locals. What we saw in Baringo must be condemned in the strongest of terms. Fellow Kenyans, remember, under the Public Health Act that has been invoked by the Ministry of Health, all gatherings, whether political or religious, remain banned. We have also noted that there are people who are presenting all manner of letters of authority to be able to move out of restricted areas. It is important for people to note that nobody has the authority to clear any person to move out of these areas other than the Ministry of Interior. We have also noticed that wines and spirits have been converted into drinking joints. These facilities are only licensed as takeaways only, and therefore we urge any Kenyans who may be visiting the wines and spirits to buy any drinks to ensure that this is a takeaway service only. And anyone found drinking at the wines and spirits shops will be arrested and the businesses will be closed down. Yesterday, fellow Kenyans, we emphasized on the importance of nutrition in boosting the immune system. We are working with the Ministry of Agriculture, Livestock, Fisheries and Cooperatives in finalizing specific guidelines that will embed nutrition security in the COVID-19 national response. Part of this will entail food preservation guidelines, kitchen garden toolkits and recipes for healthy snacks, and guidelines that help us maintain our healthy diets. I do appeal to fellow Kenyans to continue working with us and to ensure that they do maintain balanced diets that will then confer them with immunity to be able to fight against COVID-19. Now, since our last update yesterday, we've tested an additional 1,330 cases. And out of these samples, 8 have tested positive for coronavirus, bringing the total number of confirmed cases in the country to 270. 7 are Kenyans and 1 is a foreign national, and none of these cases has a history of travel. 3 emanated from our quarantine centers, and 5 were picked by our surveillance teams from various parts of the country. 4 are from Mombasa, 3 Nairobi, 1 Kajiado, and all aged between the ages of 17 and 65 years old. I'm glad to also announce that we have 7 other discharges today, taking the number of recoveries to 67. And this is encouraging, and we hope that many more will recover. Sadly, however, we have lost 2 more, thus raising the number of total deaths to 14. Yesterday, we gave a rundown of affected areas in Nairobi County, and we've noticed that almost every estate in this county does have a case. And the situation in Mombasa is not any better. Kwa sasa, Nyali inaongoza na kesi 11, ikifuata na Mvita na kesi 7, Kisauni 7, Changamwe 2. Na kule ndani Nyali, karibu kila kona kuna kesi ya corona. Bamburi 2, Beach Road 1, Mamba Village 1, Mogadishu 1, Mkomani Tamarind 1, Maweni Kongowea 1, Twiga Road 1 na Umoja 1. Kwa hivyo huu ugonjwa umeenea kila pahali Mombasa. Na ni jukumu la kila Mkenya kumshika mkono gavana wa Mombasa Ali Hassan Joho pamoja na serikali kuu kuongeza juhudi za kukabiliana na hili janga. A total of 2,661 contacts have been monitored, and out of which 2,047 have been discharged. 614 contacts have been are on follow-up at the moment. Fellow Kenyans, so far we've conducted 13,239 tests. Once again, I would like to remind all Kenyans, those in the villages, to remember our mantra of social distancing. Remember to wash your hands often with soap and running water. Remember to wear your face masks. Remember to observe basic hygiene and remember to stay at home. Fellow Kenyans, at this juncture, I'd like to invite the Cabinet Secretary of Trade, Betty Maina, who will be giving further updates on our COVID response 19.